Hello and welcome to all our beloved White Army members to this introductory session on our new course, that is SSS, Surgery Simplified for our students. This is basically an exam-oriented online classes for undergraduates as per our newly devised CBME curriculum. Just to give you a brief account of our White Army, in 2020, during the first lockdown, during COVID, I started this White Army YouTube channel. White Army discussions were there since around 2015 or so in WhatsApp groups and other platforms. But YouTube channel particularly, I started during COVID lockdown. What happened was students were all stuck at home. In many colleges, they were taking online classes. That time, this online teaching modalities and all that were not that great, the initial periods. So although in many colleges they were taking online theory classes, but the actual medical students, they were lacking the hospital visits, the clinical bedside teaching. So what we thought was, there are so many resources for theory. These books are good enough for any theory. But for practicals, you have to learn from a teacher, for experienced a teacher only. There should be a mentor to learn practical aspects. So what we thought, we shall conduct practical classes for our members. We'll ask some of the volunteers to present some clinical cases, and we shall get the best of the best mentors for that particular topic and discuss the cases, clinical cases, just like how we do in the hospital's bedside. So that was we got very good response for that. And as you all know, nowadays, entire country or even the abroad for that matter, students, medical students depend on or watch these clinical videos for their clinical presentations or during practical examinations. We have all kind of case presentation, including all clinical subjects, variety of cases in our YouTube channel. But everything was there in a very random way. All the cases we were used to discuss in a very random basis, and students were like they were happy with the content, but they had to anticipate when will be the next class or what will be the next class and so on. So to avoid this, now we have done a structured way of teaching, starting from the theory of the surgery. We will make it a very organized and structured way of classes. Starting from today, we will begin with the surgery. Depending on the response, we will start other subjects as well, like medicine, OBG, pediatrics, and third year, second year subjects as well. So first, we'll start with the theory, and then we'll also have offline practical sessions in many cities of our country, like Bangalore, Chennai, Hyderabad, Kolkata, Mumbai, so Delhi, and in major cities. We shall just before 1 or 2 months before your examinations, we will come there along with the senior faculties and teach you the practical aspects, how to examine any case, how to approach to any case, and what are the usual viva discussions happen. All this we will demonstrate you live in the sense in an offline module. So that is secondary. Now before doing that, we should have a theory strong knowledge. So we thought we'll conduct in a very organized manner. So me and Dr. Nishant, both we decided to take classes for you in a regular basis. Every Mondays, I will be taking classes, and every Thursday, Dr. Nishant will be taking classes for you. And when we launched this course, many of our members had a lot of doubts or a lot of queries. So to give you all the clarifications, we have this introductory session today. What we have done is we have kept it as a premium, feature of our YouTube channel, because to make it a very quality content, we can't just make everything free of cost. Okay, so we have kept a very nominal fees this time, unlike all our White Army initiatives, which were totally free of cost for all our medicals for so many years now, 8-9 years. But now, to make it a very structured, to get into some seriousness into this course, because you know well, or medical student, anything given free of cost has no value at all, has got no value. I was working in government hospitals. I was working in charity hospitals. Whatever the treatment you give, people or patients take it for granted. They don't value it. What are the hard work you have done? But we don't expect anything from our students, especially in a monetary basis, but to bring about some seriousness. If you have paid or if you have given some value, value it, then we'll consider seriously. Yes, I have paid there, so I have to watch those videos. I have to attend those classes. So we will take it that way. It used to happen earlier also. There were, in one hand, we had excellent Vitamin videos for practicals. At another hand, we had some other videos for paid version. Even the contents are better here, people used to prefer here because they have paid. They have paid enormously there, so they used to, because Vitamin videos are available anytime for anyone, correct? So they can watch it anytime at their convenience. But this is not like that. They have a subscription for 6 months or 1 year. They have to finish off everything within that period of time. So there was no the seriousness was lacking among the members. So to bring about that seriousness and to orient them in a proper way, we have kept a very nominal fees of about 1,999 for this entire course of about 80 hours. Entire course will complete in 5 months. Okay, weekly 2 classes of 2 hours. So totally it will come around 80 hours of theory, and then we'll have 20 hours of practicals as well. We'll have clinical approach to all the cases, major cases, theory, as well as then we'll be having offline demonstrations in your own cities. So why this amount? Again, even all the clinicians, all the teachers are also busy in their own practice or their college teaching, etc. So they have to spend extra time and extra amount of energy to teach you here. In White Army, as you all know, we are divided by college, but united by one common platform, that is White Army. Wherever you are, whichever college you are in, irrespective of that, you get to learn from the best of the best teachers. I have always made sure that you get to learn from the best teachers. For example, for thyroid, Professor Dayanand Babu is the best teacher, and I have requested him to take classes for you, and he has taken for you. For pediatrics, Amdekar sir is the legend, and we requested him. He has taken classes for you. Similarly, neurology classes, you very well know. Our Chandra madam is best among one of the best finest teachers, most dedicated teachers in our country. She's been regularly taking classes for you. So like that, you, irrespective of the college, place, or whichever year you are in, you getting to learn from the best of the best teachers. Even they are happy teaching you, looking at your responses. So here, first we'll start with the surgery classes initially. Depending on your response, we'll be starting with medicine also, OBG, pediatrics, and then we'll be starting with third year subjects as well. So we have to give some honorarium to our mentors. Unlike earlier, we never used to give, just with the goodwill or a trust with Kishan, they used to take classes. But now I feel they have been doing so much for us. So in turn, we have to give them something. So this honorarium, whatever we collect, will be utilized for giving to our mentors. And also we need to create for going further, we need to create our own applications and like other study platforms. So this, whatever the, you are all our core members, initial supporters. So whatever you give, that will be utilized for the expansion of this White Army alone. Second is, what if you can't attend live classes? This live class, see, there are so many apps are available, so many websites are available, but the problem is there are they have their own errors, like they lag, they get stuck. Many problems we are facing with so many apps what are available. But here, the time tested ones and the technologically sound ones are what I found online. They're good, and what we are using for so many years now is the Zoom and YouTube. So now we are sticking on with these two platforms only. For live classes, we utilize Zoom platform. It will be a closed class. Okay, whoever registered members are there, they will attend the sessions. Okay, and it will be a one-to-one interaction can happen. You can anytime you can raise your queries there anytime. We'll immediately try to answer them and solve your doubts. And That will be a live sessions, 1.5 hours of class, and then after that half an hour we will discuss the doubts, MCQs, etc. Every class will be like this. Initially we will have a set of questions or previously asked. We will discuss what are the questions asked from that particular topic. Then we will discuss the topic in detail. We have a set of template. See, here our basic idea is to teach you the concepts, basic concepts only. We will not teach you any hi-fi funda here. Only basic concepts what's required for it. How to write it in an exam. See, what happening is information is overloaded in everywhere, in books maybe, or whichever content you take, information is overloading. So at the end of the day, students find it very difficult what's to be written in the exam, how much to be written. It's really confusing. So what we do here, for example, for surgery, there are some 4 or 5 books are there. In 1 year, it's so vast, you can't read everything in 1 year, even though if you're interested. So we have been studying surgery for so many years now, and we will culminate everything into one notes or one PPT, and we will teach you what are the really required at this level. Okay. So for example, for a 10 marker question, you need to write 10 points only, 10 important the keywords. If you write, any examiner would be happy to give you maximum marks. So we will tell you which are those 10 keywords to be written or must be written. So we'll make it into a notes form also for you, so that it will be very handy for your quick revision just previous day of your exams or like that. So that is the one thing. And along with the live class, soon after the live classes, there will be MCQ session also, because in CBME curriculum you have 10 MCQs asked along. So we will discuss similar MCQs also and how to solve them. That also will be discussing. And soon after the class, we'll be sharing that PDFs notes with you in the closed WhatsApp group. We will create a WhatsApp group for the one-to-one mentorship of our members. So therein, we will share all the study matters, not just the class notes, but whatever required for your examination or day-to-day studies, everything we will share there. We all the Viva materials, practical, everything we have ready-made. So we will keep sharing there. We keep sharing there, and time to time basis, what are the revision materials are required for you. That also we provide every Sundays or Saturday Sundays. We give you sample MCQs or sample questions or sample tests. That all happen in a WhatsApp group. So those who are paid 1999, they will get live classes on Zoom. Secondly, they'll have a membership of a WhatsApp group, exclusive WhatsApp group, where all study materials, discussions, and mentorship happen. Okay, that's the one thing. Now the question is, what if you cannot attend the live classes? You are from other country, or you're from some different time schedule where you cannot join the classes, or you have some exams on that particular day, so you cannot attend the live classes. So what if so? So then what we do is we record all these. We record all these classes, all our classes, just like our previous White Army videos. We record all this in YouTube, so permanently it will be recorded there. Anytime you can access. You need not have any separate subscription for like a yearly basis or something like that. Anytime you can access. But if you make it available just like in a White Army YouTube channel, anybody can access. Then what is the difference between one who has paid and one who has not? Okay. So to distinguish that, we have kept it as a premium feature on YouTube. All these recorded classes will be as a premium feature. So as per the YouTube rules, YouTube policy, you have to pay nominal fees to subscribe into the premium, what are the membership. Again, there we have kept a very nominal fees. Actually, in YouTube, it happens a monthly basis. The payment happens on a monthly basis. So we have kept like a 299 rupees per month. Again, if you keep it very low, then it will be like a partiality towards those who attend live classes also. So live classes, the advantage and disadvantage I'll tell at the end. So in YouTube, it's a separate, only recorded videos are available. If you could not attend any live classes here, or if you can't attend, then you can watch our recorded the same classes on YouTube for per month 299 rupees, because we calculated like for the entire course even in the the other platforms, it comes around per subject 3,500 rupees, 3,000 to 3,500. So 2000 for the online live classes, and you require maximum for 5 to 6 months. This YouTube videos, recorded videos. Next, now anyway, it's June. Exams are in December. So June, July, August, September, October, November. And then 5 months or 6 months you may use. So 300 into 5, 1500 it comes around. Okay. So, or if you can't use now, or if you don't use now, you can just use for 1 or 2 months during exams also. Or if you're having exams in a March, just 2, 3 months before the exams, you can use anytime. Any month, for that particular month, you can subscribe by paying just 299, and you can avail to all the videos, all the entire class videos. You can get there in the anytime, even after 2 years, 3 years, you can avail that recorded videos. That's the advantage. But the thing is, we cannot share any notes there on YouTube, because we will not come to know who have registered for that class. As a admin here, I will not know. I'll just get the just a name on your, like, that will not anyway clear. Whatever YouTube names, whatever you are given, that I'll not come to know. So I cannot share any kind of study materials with you, or I cannot have a direct interaction with you. That's the problem. But just for classes, YouTube recordings are enough for you. But if you really need the mentorship, the doubt clarifications, and study materials, everything, then live classes are preferred for you. So these are the two options. Just online with offline. I would prefer it's a device in such a way that all of our members should initially subscribe into this online live module. Okay, that's on Zoom platform. And also for later revision and all, they need to subscribe into YouTube version, YouTube membership as well. So all over, it comes around 3,500 rupees for you. Okay, so in that you will get live classes and all study materials, live class of about 80 hours, and all the study materials, including the class notes, revision notes, and question papers, previous year question papers, etc. And any one-to-one guidance and mentorship, all the doubt clarification. And also for a monthly basis, that depends on how many months you want, 299 rupees. That separately you have to pay for YouTube, because we get only minimal amount in that. As admin, I get YouTube keeps a maximum share of the 299, and only some amount of will be given to White Army. Okay, so that's it. That's about the subscriptions, and we are committed both, because why I started only with surgeries. You all know me and Nishant very well. Since so many years, we have been teaching here on the platform, and we have been giving good quality content for free of cost. Both of us are passionate about teaching and dedicated towards our students' welfare. We have been doing all our best to bring the best in you. So you know both of us very well. You have goodwill with us. So many students, see, when we launch this course, when I put one message in the WhatsApp group, immediately within 10 minutes, I got nearly 300, 400 responses that saying that I'm interested, sir. Where else you will get to see this kind of response? So good thing about the White Army is it's still not commercialized. Okay, it's still not commercialized. Education is at its best, even free of cost here. But this time I told you to bring about some seriousness among students, and also we have to launch this platform to the next level, for which the fundings are required. Okay, and we teachers, we don't want to take it's like honorarium. I will give it to the because further we will bring about senior faculties also for medicine and all. So we have to pay them accordingly. So we take a nominal fees from you, and we'll be paying them a huge amounts to them, so that they also take more interest to take classes for you. That's the idea here. Please don't misunderstand or mistrust us. That yes, Kishan sir was giving everything. It's like Geo. He has given everything for free for so many years, and suddenly he started charging now. No, no, no. Even our free videos will continue to it will be continued. Even for example, tomorrow also we have another case discussion on varicose vein. Wednesday, Chandra madam's class is there, so that will continue like before. That will never get we'll never ask you to pay anything. But these courses particularly, whatever the course next will become with the medicine course, all similar, that we will keep a nominal fees for that. With that, if you have any doubts, any of your members have any doubts, you can ask me directly. And yeah, in this class, both of us, me and Nishant has specifically said, we will be giving them good concepts. Okay, they can attempt any exam with that, not just your university exams, even for entrance exams also same concepts are asked. Okay, nothing different. They will not ask any economics or geography there in your PG entrance exam. So we will give you good concepts with which you can attempt any questions. And simultaneously, we will giving a structured way of answering what's really required. Pheochromos item, if asked, what are the 10 points? A long case say, what are the 10 points must be there in your answer sheet that we will be giving you. We will also be writing along with you, and we'll be sharing the notes also. So you will not miss out anything. We are very sure this is going to be a very valuable class for you all, and you will be very confident. I'm not just saying for the sake of it, but really mean it. And we are really among despite having busy schedules, we are both of us are busy practitioners. He's in Bangalore, I'm in Mangalore. uh, we do a lot of teaching here also, and we do a lot of surgeries also every day. We have our own commitments. So we, along with that, in these evening times, we take out to study to teach to our students. Along with you, we will also study. Okay, so let's make it as a study with surgeons. Okay, for our students, let's study with the surgeon. What's our surgeon's mindset when he studies a subject? What is his mindset? So that is the whole idea. So if you have any kind of doubts, you can directly ask me. Unmute yourself, and you can ask me directly. You need not have to put in the chat section. You can unmute yourself and you can ask me. Okay. Anything you want to ask? Okay. Sir, where would Anne is asking, sir, where would be the pre-recorded classes available? There are no pre-recorded classes as such. I just told you these live classes, what we are taking today, we have a demo class. Many of our new members wanted some sample classes when they are paying, how to make sure that the quality is good, and also, so they wanted some demo classes or sample class. Yeah, we definitely will do. Today I'll take one demo sample class, and on Thursday, Nishant will take one sample class for you. Same, the classes will continue. This is the first topic today, wound healing, very important. He will be taking on surgical infections on Thursday. So we'll continue with the topics, but first two classes will be accessible by anyone for you to assess our quality and our dedication, and then you can decide if it's really useful for you, really required, whether you are whatever the money you are paying worth it or not. Okay, and so sorry, live class if we have missed it. Okay, that's what she's asking. These all our live classes. What do you see? We are having now. This also same being live streamed in YouTube, and it will be recorded there. Okay, and when you subscribe there, you will not get otherwise. Only members will get that video. There's a option called if you go to join in our YouTube channel, there's an option called join or membership. If you click on that, there's so many options. 89 rupees, one is there, 199, 290. So 89 rupees is these are all our patrons. They are White Army commanders, White Army captains, White Army soldiers. There are so many options that we created earlier for like patronizing or whatever our initiative was there. So now we cannot go again with the same amount because that value has been already blocked by YouTube. So whatever the minimum amount was available for now was 299. So I went with that. So when you pay a monthly payment of 299 rupees, you will get all the videos so far done. So far, what are the places been taken in 1 month or 2 months, whatever been taken, you'll get access to all those videos. Is it clear? And okay, Zaheen is asking which book to refer along with your notes and lectures. Excellent. So see, we refer from our class for our classes. We refer from all the books. Okay, even and at the end of my classes, you'll get know my references also. I take from Bailey, Sabiston, Schwartz, SRB, Manipal, all the books possible. Okay, from best of the best content from each book, I'll take and put it in a notes format. But having said that, this will be our notes will be in common with what are commonly read books by our UGs. What they can easily comprehend and remember. That's for sure. Recent updates, everything will be giving you, but will not make it very hi-fi or like what to say, difficult to remember things. We will make our only intention is to make it as simple as possible to understand, to remember, and to later write during examination. So any commonly referred books by you, maybe be it SRB or Manipal, Manual or Bailey, whichever you read, because content is same in almost all the books. surgery only, wherever, whichever book is. Only presentation is different. Okay. But what's the problem? What I felt is it's very humongous, very voluminous, that much is not really required. As a UG, you can't really distinguish whether it's really required for you or not. So we will make that job for you easy. Okay? So you can just follow our classes. That's more than enough for any university examination, including your entrance examination. But definitely, I don't say this is the only source. You have to study simultaneously along with our lectures. We'll be highlighting only on the important topics and the most high-yielding topics and basics. Along with it, here and there, some minor topics are there for your entrance perspective. You have to study from books only. So Jayalakshmi IR is asking, sir, before and after lecture, how to prepare that topic? Excellent. That's the specialty of our White Army. We are always perfectionists. Okay. Anything and everything we once committed, we'll deliver it at any cost. We have already given the entire 5 months schedule for you. We have already shared it in our WhatsApp groups, Telegram page, everywhere. That we already prepared the 5 month schedule, and date wise, time, every topic, mentor, everything we have prepared schedule and we have given it to you. So you already know today's 20th, the topic is wound healing. 23rd, the topic is surgical site infection. On 27th, it is shock. Like that, you already know the topics. So come prepared beforehand for that lecture. So when we ask some in between, I'll be discussing some questions with you. I may ask you some, see how to go about this, Jayalakshmi. See, you have a wound like this. How to go about this? I may ask you. That time you have to answer. If you have come prepared, then you can answer better. Among all other members, your confidence will boost up. So that's what required. Finally, my success formula is hard work plus self-confidence equal to sure success. So you will gain that confidence or self-confidence by little bit of pre-preparation before coming to any lectures, or answering when in such a platform when questions are asked. By all this boosts your confidence enormously, and which will lead you to success. Next question is, do we need to take running notes, or the notes provided will contain all the information? Excellent. Yeah, Dr. D. King, you need not have to take any notes during the session. Okay, for sure. I'll be writing. Okay, I'll be writing. You just listen to us. You'll just listen to us. I'll be giving the whatever the pre-written content along with it, whatever I write during the class. I'll be sharing that PPT with you, or a PDF with you in a PDF format. So just to avoid sleeping or more on this thing, you can scribble something, but really you need not have to write anything during the classes. Okay, but if you write along with me, that's good. I'll be it will be practice for you how to write in exam, how to do, what are the things you should draw in the exam. If a question is asked, surgical anatomy of breast is asked, how you need to write this, where you in a diagnosis of carcinoma breast, how to represent it pictorially. We will share, and we'll also draw along with it. If you draw, it's well and good. Or for record purpose, you need not have to take down anything. Everything will be provided to you. Is it okay, Dr. King? Any more questions? If you ask, or else we'll start with the demo class. We have to leave this session and again join back, okay? Because that will be a separate YouTube session. So if you have, before that, if you have any questions, please ask me directly. Otherwise, we let's move forward for the demo class. In YouTube, there are some questions. Let me take them. Dr. Gani is asking, sir, can interns join for gaining concepts clearly? Definitely, because surgery is surgery. If it's for UGs or interns or PGs, the content remains the same. Only the depth varies. For UGs, we tell only what's required for the exams, the concepts. For interns, we will tell some orientation to the practical approach during the internship, and also for the post graduation. And for PGs, of course, in depth, we have to teach the same content. So what about the next exam batch? See, it's still not finalized. That they keep the rumors are keep coming. So don't worry about whichever the pattern is. Surgery. NEET, next, INACET, whatever it is, the content remains the same. Okay, or only the pattern of questions may vary a bit. But if you know that's what Nishan and me were discussing the previously also. Like we will give them the good concepts so that they can attempt any exam, be it next, NEET, or some other in the future. You'll be ready to face them. I apologize for the off-topic question, but can I know the release date for the book all-in-one case pro forma? Excellent. That's yet another venture by White Army. That is soon, another 1 week or so. Most probably, I'll do it on June 1st. Okay. I have compiled all your possible cases: general medicine, general surgery, OBG, pediatrics, orthopedics, all five final year, third. It's required for all the years. Even for interns to write the case sheets in your this thing. Even for PGs, it's required. Even for nursing and dental students, also it required. One thing in your books, you can't keep referring. Okay. So I have compiled everything into from my own experience as well, and from White Army videos as well. What are the examiners asking, expect, that I have compiled into one book, in a very short handbook. You can keep it in your aprons, okay, apron pocket of 150, 170 pages, all put together, all 5 subjects. Every case is ready-made prepared there. Okay, you osteomyelitis case you want to take, it's a ready-made case pro forma is there, and along with that, at the end, there are some tables or some discussions which are you must know. If you get a osteomyelitis case, those are the questions which are inevitably asked. In hernia discussion, there are some questions: why direct, why not indirect? There's a question indirectly asked, sorry, inevitably asked. So that's already, that chart is already given in the book. So if you just go through that pro forma and those tables, you can confidently take any case in your bedside clinics and also present it to your professors there. That's the whole idea. So that book will be released shortly in another one. It's gone for printing. So once I get do the proofreading, and we'll be making it available both online and offline in the online platforms like Amazon and in websites also, and in all the leading medical booksellers. That book will be made available. So that's called all-in-one clinical case pro formas. Okay, that book. Please make the best use of that also. Next question is, thank you, Parth. He's telling it's a great effort, Sirji. Then Shivarshini is telling, sir, does this schedule include entire surgery syllabus? Yes, of course. This is as per the CBME curriculum. This is a second batch. So whatever the CBSE prescribes you to know, that everything will be covered under this. So only those topics will be covered. And here and there we'll be telling, see, for example, today, in metabolic response to injury, only 2 topics have been asked in CBME, but one important topic to be known is ERAS. That I'll be discussing, telling in extra. That is important for your entrance exam point of view, and also for internship. There, in the rounds, the question will ask, this patient we are discharging today itself, Dr. What is it, Chandra, and what's that called? In the rounds, the professor may ask you, sir, let's do ERAS. Okay, early recovery after surgery, and we'll plan for ERAS. And so that's how some concept, basic concept you must know in surgery, that also we'll be discussing along with your CBME syllabus. OnePlus is asking how much time it will take to complete whole surgery portion. That's what I already told and already given the schedule as well. It will take around 75 to 80 hours if you consider the entire portion. So we'll be covering within that. Any other questions? Schedule, if someone has not got the schedule, please text me, or you can go back and check the Telegram page. We will send the entire schedule there. Any other doubts? You can unmute yourself. If you can't type, you can unmute and ask directly, no problem. And I want some feedbacks also from students, like any apprehensions they have. And if you want, yeah, sir, whether Shankar Narayana from Tumkur is asking, are a very regular and active member. Sir, whether in between class schedule, there will be any test or after course? Yes, of course, I told you, no. Every Sundays, we will be giving for revision and also for your self-assessment, we will be giving some MCQs that will be useful for your university exam as well as the entrance exam, and also some revision questions. Okay, so for you to revise yourself, self-assessment questions will be giving you. And those are we are also examiners. We also have setting question papers. So we know the mindset of any examiners, what they expect, and from students, though we will definitely make you practice all those things. Any other questions? And yeah, the best thing was from our members, we got registration from all over India. Be it Haryana, Madhya Pradesh, Telangana, Kolkata, Mumbai, and great colleges of Delhi, Bangalore, Mysore, everywhere we are having students. So this is going to be a very interesting and very informative class. And looking forward to learn mutually. I'll also be learning something from you, and whatever I know, I'll try to share my do my level best. If you really want to know more about us, even you can't still decide, please watch our all previous videos on YouTube. There are so many videos, hundreds of videos on surgery and career counseling, motivational. So many questions are there. So many videos are there. Sorry, you can watch them. Tejas is telling, sir, I think today's topic and general surgery concepts will be helpful for all surgical subjects and not just surgery like ENT, ophthal, and ortho also it will be useful. Yes. See, I'll give you just a glimpse of our classes. Okay. One because this is actually secret only for registered members, but it's okay. All are my students only. You're all my our own family members. So I'll be just giving you a glimpse. We make you write any and every question. Okay. Here the simple thing is you need not have to remember everything. I'll give up such a beautiful template. You need to just fill in the blanks. Fill it in. To fill that, you need not have to study anything separately. Whatever you know already, that's more than enough. For example, any question, I make you write it in a template, having 5 subheadings. First thing is introduction. That is any definition, any classification, or any anatomy need to be written, or any all those things will come in the first side heading. That is introduction or definition. Second heading is etiology or the causes. Again, for that, I have 5 subheadings under that etiology. Any etiology for any disease can be of 5 types. Okay, it can be congenital, it can be infective or inflammatory, it can be traumatic, it can be neoplastic or idiopathic. So find one cause from each. We'll get the 5-6 causes or risk factors for the same. Third heading is clinical features. It includes again symptoms. You'll write 3-4 symptoms, and any for thyroid, the symptoms will be the swelling and the pain or compression symptoms, all those things. And signs. What the on examination? What the elicit? There is a non-tender and this what the swelling. All those things you'll write in the signs. Pemberton signs or Berry signs, Cocker sign. What the sign is there? You write in the clinical signs. So clinical features done. See, already one page is over, and second page when you turn, it will be investigations. The fourth heading is investigations. Again, in that template, you have 3 subheadings. Investigations can be classified into 3 types, correct? One is lab investigations, that is blood investigations, radiological investigation, and pathological investigations. So something you write, radiological, CBC, RFT, LFT, you write. So you have filled up something, so you should get some marks, minimum marks, even though if you don't know accurately. Second thing is radiological. You write ultrasound, X-ray, CT, MRI. One among them is right, definitely. Third thing is pathological, that is biopsy, FNAC or core needle biopsy, you write, that's correct. So whichever is most relevant, you write it first, then other ones. The fifth heading is the treatment. Again, for treatment, you have 3 subheadings. It could be medical treatment, interventional, or surgical. So already 10 points, 10 headings are already, it's ready. So already written. You need to just fill up in front. What the medical management for varicose vein, what the interventional management for varicose vein, that you already know. That what's the surgical treatment for varicose vein, that you already know. You need not have to remember or recollect or break your head. Just know the template like that for everything. Even any complication asked, complication of this particular surgery, I have template ready for you. Okay, what's the intraoperative complication, what's the immediate post-operative, what late post-operative. For that also mnemonics are there. Okay, I'm not a big fan of mnemonics and all, but I'll make it very simplified for you. Okay, so Jayalakshmi is asking, sir, can you repeat the etiology 5 headings? Okay, first is as we just take a from birth death. First is congenital, and as we are born and move here and there, we are prone for trauma. Okay, then as we go to school, we are prone for all kind of infections. Okay, and then as we grow old or 40s, 50s, then we get different types of neoplasms, be it benign or malignant, and some things really we can't know. We don't know what is that idiopathic autoimmune disorder, some collagen vascular disorders, all those things. They're all put into idiopathic. So these are the 5 etiological varieties you have, subheadings. So any other doubts? Many more are there like this. Even Nishant has got his own way of teaching. That will be really interesting. And anyone wants ultimately one line. You need not ask. I'm a first year, sir. What to do? I'm a second year. No, not to. Why I'm a first year PG? What to do? Intern? No. Irrespective of whichever year you are in, whichever place you are in, whichever college you are studying, how much ever good you are, topper, top topper, bottom topper you are, it doesn't matter. Whoever interested to learn surgery more and better, we are here. Okay, so you can make the best use of this. And any other doubts? Parsing is telling surgery simplified by the surgeons for the students. Yes, we can make it as SSS. Yeah, I'm a fan of this kind of rhymings. So we'll just, for now we'll keep it as triple S, because we consider ourselves also students only. We are senior students. We were junior students. Okay, from senior students to the junior students, we are also learning from you. So we don't consider ourselves to be surgeons or something. Is that okay, Parth? Anything else? Any questions on YouTube? Are notes available for demo classes? Yes, demo class also notes available today. Hi sir, what will be the pricing of the proforma? It will be yet to be printed. So let me know the printing cost. It will come around 200 to 250 rupees. That's it. And sir, PG can also join. Yes, I told you, no, whoever is interested to learn the surgery more and better, they can join. Sushinda Joyce sending love from Tamil Nadu. Thank you. Rahul Yadav is telling, if we buy the course and are unable to watch a class, can we get the recorded lecture from Zoom on WhatsApp? No, dear. You can get only from YouTube. All the recorded videos are available only on YouTube. Okay, that's it. So many students are waiting for the demo class. So let's end this. If no more questions are there, then we'll end this session here. And please rejoin us with the same link, same Zoom link. Please rejoin. For YouTube viewers, the link is different. You can go to our, already I've shared on the groups, but Dr. Nishant has just joined us. He was traveling. Just some concluding remarks from Nishant. Okay, many students want to see him and to interact with him. So, Nishant, are you there? Yes, Dr. Nishant is here with us. The long term, he's one of my best friends, and also the one of the core mentors of White Army. He has been taking classes for since the beginning of White Army. Excellent videos are there on YouTube channel by him. So his advice for our members. Dr. Nishant, please.
Thank you. Thank you so much for the lovely words. So I said, so like Kishan has been saying, the idea of us starting this particular course is to make sure that you guys pass the surgical final exam or your university exam with flying colors. Now, the thing is, what's different between, well, I was just looking at the question, what's the difference between Marrow and us, and what's the difference probably between us and a solved question bank is the fact that in Marrow, it's information overload. Okay, I'm also I'm a subject matter expert at a different app, but the way we teach for NEET is completely different from what we do for undergraduate students. For undergraduate students, like we said, we have devised a proforma, a protocol to train you guys to write the long essays, the short essays, and the 3 markers. Now, it's not just giving you the notes, it's also about trying to make you understand the concept and to make probably a 3-page topic from a textbook to 1.5 page on your answer sheet. So that is the idea of us trying to conduct these classes. And of course, at the end of the day, if you've understood the concept, you guys will aram se pass even the entrance exams, to be very honest. Although we're not specifically looking at the MCQ point of view and trying to pick out like which is the most common, the best investigation. The idea is to make sure that if you've understood the concept, either way, you'll get all these answers right. And in a textbook, like, for example, I'm sure all of you have read Bailey and Love. It's like a huge, it's a voluminous textbook, 2 volumes. To be honest, I read them in my PG. Okay, I didn't have the time to read it during my UG days, and I actually repent for it. So the thing is, it's a lovely book to read, but to convert that into an answer is a bit difficult. So that is what we are attempting to do: teach you what's given in Bailey and Love and convert it into an answer format so that it will make your life easier when you're giving the exams, because your final exams will be a bit difficult because you have a lot of major subjects. So hopefully, if you can cover one gradually, like what we are doing stepwise, it will make your burden towards the end of the exam much more easier. So that's all I had to say. If there are any questions or doubts from the students, I'll clear them.
Yeah. Any questions to particular to Nishant? This course does not involve any ortho topics.
Unfortunately, no. That is because ortho is a very small textbook, and you just have to learn 4 or 5 important questions in that. That's all. Okay, and forget about the rest, and eventually all your topics will be from these 4 or 5. So we'll see probably at the end of the course, if we have time, we will try to get in somebody to cover it for you, but highly unlikely. Okay, it's like I said, our idea is to concentrate more on general surgery because it will also help you in your practical exams and also for your entrance exams. So we are covering a major subject in a very constrained time frame. And when we say the time, yeah, sorry. So when we say the time of 2 hours, or let's say 70 or 80 hours, so please understand, we might not be involving the entire 2 hours is not just us talking. It's going to be an interactive session where we're also going to clear doubts. Like, let's say we're talking about hernia and you have seen a hernia case in clinicals, and the examiner said something and it is contradicting to what we have said or what's given in the textbook. So we will clear it then and there as we are doing it. Of course, we might not go as in detail as what are the inspection, palpation findings and all, but as much as possible, we'll be happy to clear doubts then and there in that session. So you won't have anything left over or any major chunks or doubts left at the time when you're writing the exams.
Like just now Tejas mentioned, see, surgery, it's a vast subject. We'll be discussing the entirely, but along with that, we'll be giving a template so that you can just that, like we are not giving you ready-made fish. We will teach you how to fish. So you can, with that knowledge or with that skill, you can attempt be it ortho or be it will be useful for all other subjects as well. Okay, to like study in a very simplified manner, it will be helpful. So don't just take it as a little just surgery class like that. Yeah, surgery content, but in the class we'll be giving you much more guidance, the tips, whatever we know. Okay. So any other doubts? Anyone want to directly talk to Nishant? Please, you can unmute yourself and you can also ask questions.
This is like a host talk show where you can ask doubts directly.
You can directly, after watching this video, if you later, if you have any doubts, you can directly contact us, or you can post it them in our WhatsApp groups, Telegram, or YouTube video in the comment section also. Anything, please ask us directly. Don't keep it for yourself. We are just here to help you. That's it. And membership that can be available at any time. Okay, it's there's no time limit or anything like that. But if you member from the beginning, you'll not miss out anything. That's the whole thing, because some the content it can be revised, but some the from the things what we say from our experience, or the what are the special tips what we give, that cannot be repeated in every class. So don't miss out any classes from the beginning, and that's all our request. How do I join WhatsApp group? Vanessa, I already joined. I already registered. Like, you're already in the WhatsApp group. Okay, for the registered members group, you're already there. But I'll be giving another link for that free discussion group also. I'll be giving you access, so you can join later after this session. You please message me. I'll send you the link. Okay, because there is a general discussion group also. You can all be a part of that. So Shall we end it here? Nishan, any concluding remarks?
Nothing
About
from
your
my side. I hope
classes?
we all have a very fruitful next 5 months and all of us learn together. And I have an ulterior motive that I want to see a lot more surgeons from this group. So I hope I
No, the
motivate
thing
all
is
of you
that,
to become
Nishant,
surgeons.
you are right. Last year also we had conducted this yeah, practical classes, CCC, that was comprehensive clinical
Correct.
classes for students, and everyone after the exams, most of the members messaged us. Hope you also received many mails. Okay,
Yes.
we said that the classes were very useful, and those videos, especially many practical videos are there by Nishant. Most of them watch them before presenting any thyroid case or breast case, or for any before any viva. So same Nishant, I will be taking the classes in much more serious and organized, and what to say, in a
Structured fashion.
structured manner. Okay, that's it for now. So hope to see you again. Today there will be a demo class on wound healing. Another, you'll be taking on surgical infections, Nishant.
Yes.
Yeah, Asha Jain is asking, sir, our class is going to be PPT based or written basis? Combination of both. To save your time, we'll be writing some things in your PPT. Along with it, we'll be writing. What are the need to be written in concepts will be in the form of PPTs, but what are things to be written on in the exam, that we will also write along with you. So it will be combination of both PPT as well as written. This what are the final PPT is there, both after the classes. PPT along with our writings will be shared with you. Okay, so if you attend the classes, you can understand those notes better, or rather than just viewing YouTube lectures, recorded videos, this would be more beneficial. Okay, then thank you so much for joining us for this introductory session on triple S, that is surgery simplified for our students. So just now it's 7:54. At sharp 8 o'clock, we'll be starting with the first class on wound healing and wound management. It is going to be a purely interactive session. I'll be giving you many case scenarios wherein you have to think and analyze. I'll be giving all the possible previously asked questions, and which are the questions to will probable questions will be asked. At the end, we'll be having very interactive MCQs discussion as well. At the end of the, it's going to be 1.5 hour class. Let's keep it very short and brief today. And another class, I'll adjust the timing to take the metabolic response class for you. Today it's already late. Is it okay? With that, let's end the session. Please join us back on the same Zoom link, or a different already shared YouTube link for the first class of this triple S course. Thank you, Dr. Nishant, for joining us. I know you are traveling between the hospitals for another surgery, from another one surgery to another. For our request to see your members, you have joined us, that too in a busy traffic of Bangalore. Thank you so much for your continued support and all your valuable inputs and insights given so far in White Army. On behalf of all the members and those who got benefited, I would be very much grateful and thankful to you, my best friend. Thank you so much, and all the active members for joining this session. And hope your support and cooperation continues. Thank you.
Thank you. Thank you so much, everyone. And let's hope we all learn together.
Yeah.